Question number 1.
Nurse Mimi caring for a patient with an indwelling catheter. The patient complains of spasm-like pain at the catheter insertion site. Nurse Mimi would expect the following signs and symptoms for a possible urinary tract infection with indwelling catheter, except A. Dark and cloudy urine. B. Tenderness with palpation of McBurney's point. C. Feeling the need to void even though a catheter is present. D. Increased white blood cells. Let's apply the process of elimination. Indwelling means inside your body. Therefore, a catheter is inserted into the bladder, remains in situ to drain urine out of the body. However, this will place the patient at risk for foreign organisms leading to urinary tract infections. Dark and cloudy urine may be due to the presence of blood and white blood cells. This makes option A a correct statement. Tenderness with palpation of McBurney's point, which is located at the lower right quadrant of the abdomen, is an indication of possible appendicitis, which makes option B an incorrect statement. Feeling the need to void even though a catheter is present indicates irritation of the urinary bladder and is a sign of possible infection, making option C a correct statement. Increased white blood cells is an indication of infection, making option D a correct statement. Therefore, the correct answer is letter B.
Question number 2.
Brian returns from surgery with an indwelling urinary catheter in place and empty. 7 hours later, the volume is 120 milliliters. The drainage system has no obstructions. Which nursing intervention should be a priority of action? A. Evaluate the patient's circulation and vital signs. B. Give a 500 milliliter bolus of isotonic saline. C. Flush the urinary catheter with sterile water or saline. D. Place the patient in the shock position and notify the surgeon. The correct answer is letter A. Evaluate the patient's circulation and vital signs. When multiple correct answers are presented, the priority action should be based on evaluation and assessment such as vital signs taking. A total urine output of 120 milliliters for 7 hours is too low. Normal urine output in an average person is 30 milliliters per hour, which means the patient should have at least 200 milliliters urine output in 7 hours.
Question number 3.
A triple lumen indwelling urinary catheter is inserted for continuous bladder irrigation following a transurethral resection of the prostate. In addition to balloon inflation, the nurse is aware that the functions of the 3 lumens include A. Continuous inflow and outflow of irrigation solution. B. Intermittent inflow and continuous outflow of irrigation solution. C. Continuous inflow and intermittent outflow of irrigation solution. D. Intermittent flow of irrigation solution and prevention of hemorrhage. The correct answer is letter A. Continuous inflow and outflow of irrigation solution. Here's how the triple lumen catheter works. An irrigating solution is hang above the patient, mostly containing normal saline that goes to the drip chamber. It goes into the first port, which is the inflow lumen. At the middle part is the balloon lumen. An air is injected once the catheter is properly placed inside the bladder to avoid dislodgement done during the insertion of the catheter. The solution then goes to the outflow lumen containing blood and other irrigated components into the drainage bag. This process is continuous and is not intermittently done at the course of procedure.
Question number 4.
Nurse Mimi placed a tape in the indwelling catheter of Ryan. So the client asked her, what is the primary reason for taping an indwelling catheter laterally to the thigh, specifically to male clients? Nurse Mimi is correct if she says A. To eliminate pressure at the penoscrotal angle. B. To prevent the catheter from kinking in the urethra. C. To prevent accidental catheter removal. D. To allow the client to turn without kinking the catheter. The correct answer is letter A, to eliminate pressure at the penoscrotal angle. The primary reason for taping an indwelling catheter to a male client is so the penis is held in a lateral position to prevent pressure at the penoscrotal angle. This will also prevent urethral erosion as the tension of the catheter is held laterally.
Question number 5.
During a client's urinary bladder catheterization, the bladder is emptied gradually. The best rationale for the nurse's action is that completely emptying an overdistended bladder at one time tends to cause A. Renal failure, B. Abdominal cramping, C. Possible shock, D. Atrophy of bladder musculature. The correct answer is letter C, possible shock. When the bladder is full, abdominal aorta and superior vena cava are compressed, adjusting pressure from the heart going down to the lower extremities and back to the heart. However, rapid emptying of an overdistended bladder releases pressure in the viscera that may cause pullback of blood, leading to hypotension and shock. Therefore, the standard practice is to slowly empty an overdistended bladder.
Question number 6.
Mark undergone a renal surgery. As part of nursing intervention post-op, which of the following would be most appropriate for preventing the development of a paralytic ileus in a client who has undergone surgery? A. Encourage the client to ambulate every 2 to 4 hours. B. Offer 3 to 4 ounces of a carbonated beverage periodically. C. Encourage use of a stool softener. D. Maintain quiet and calm environment for the patient to take rest. The correct answer is letter A. Encourage the client to ambulate every 2 to 4 hours. Peristalsis is the involuntary contraction and relaxation of longitudinal and circular muscles throughout the digestive tract, allowing for the propulsion of contents going to the anus. During surgeries, analgesics and anesthesia causes this peristalsis to stop, which is called paralytic ileus. To prevent this, ambulation is encouraged to patients as part of post-operative care.
Question number 7.
The nurse is conducting a post-operative assessment to Mark on the first day after renal surgery. Which of the following findings would be most important for the nurse to report to the physician? A. Temperature of 99.8 degrees Fahrenheit. B. Urine output of 20 milliliters per hour. C. Absence of bowel sounds. D. A 2 by 2 inch area of serosanguineous drainage on the flank dressing. Let's apply the process of elimination. A slight elevation in temperature is expected immediately after surgery as a normal response of the body, which makes option A a correct statement. The acceptable urine output is 30 milliliters per hour or greater. The decrease in urinary output may indicate inadequate renal perfusion and should be reported immediately. There is a possibility that the kidney could become damaged during the surgical procedure, making option B a negative statement. During surgeries, analgesics and anesthesia causes this peristalsis to stop, which is called paralytic ileus, and is expected in post-operative care, making option C a correct statement. A small amount of serosanguineous drainage is to be expected. The client will be encouraged to move around as soon as he can after surgery. This will stimulate blood circulation to help prevent blood clots, making option D a correct statement. Therefore, the correct answer is letter B.
How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.